can be helpful in dementia, even in the end stages of dementia where other forms of stimulation evoke no response. Music can still elicit reactions. It can elevate mood, reduce anxiety and agitation, help with insomnia, and improve quality of life. Part of that effect may relate at times to triggering those autobiographical memories. In fact, this is rather exciting. Research by Professor Michael Taut suggests that familiar music may enhance cognition in dementia by producing new structural and functional growth in the prefrontal cortex, an area where deep cognitive processes lie. So this might offer some hope of an active therapy that could be tried. Now, we alluded to rhythm before, and it was long thought that only humans have beat perception, but check out this video. Okay, now you're going to be skeptical of anything I show you. Okay, that is a fake. They added music on top of their movements. But check this out.
Yeah, go Snowball.
So believe it or not, certain rare species actually can entrain to the rhythm. Cockatoos, some varieties of parrots, and a few other species, like a famous sea lion named Ronan, do appear to have beat perception. And I thought I was a great dancer, but look at. So now let's talk about where rhythm can be used to help with neurological health. Parkinson's disease is a neurodegenerative disorder characterized by progressive motor difficulties such as tremors, rigidity, slowness of movements, and assorted walking difficulties such as freezing, shuffling, and unsteadiness. The problem is not actually due to a motor weakness per se, but rather it's a difficulty in initiating, controlling, and coordinating movements. Research advanced again by Professor Tao demonstrated how the beat of a music in a rhythmic auditory stimulus can help such individuals initiate and enhance their movements. Here is a video kindly provided to me by the eminent music therapist Concetta Tomeno, which makes the point. So look in the beginning.
Probably facing the other way. That's good.
Now with the addition of music. Now, another area that music can be very helpful in is a topic called aphasia. Individuals who have suffered injury to the language center, usually but not always in the left frontotemporal region, may have what is termed expressive, non-fluent aphasia, in which there is difficulty forming words or sentences, and grammar and pronunciation are often off. Injuries can be from any cause, such as a stroke, a hemorrhage, trauma, even a bullet wound. Regaining speech in many situations, even with vigorous traditional speech therapy, can be very incomplete. One wonders then whether music can help. Years ago, it was observed that individuals with such aphasia which causes great difficulty producing words, but curiously could sing the words and sentences with a pretty good fluency. This led to the development of a technique called melodic intonation therapy, in which short phrases are given melodic pitches to them to be sung or intoned with a slow and steady rhythm. And the individual typically taps the phrase rhythms with the left hand. Many of you may be familiar with the story of former U.S. Representative Gabby Giffords, who suffered a shooting assassination attempt. This video you can find on YouTube is based upon an ABC report.
Today, for the first time since her injury, Congresswoman Gabby Giffords released a special message to her constituents.
Representing Arizona is my honor.
A transformation that began 9 months ago when she could barely respond.
Can you smile, sweetie? Oh, that's not a smile.
Because she was injured in the left side of the brain, where speech is controlled, her words had abandoned her.
What's the matter? Yes.
In this emotionally charged moment, she sang the words she couldn't speak, a key to her amazing recovery.
Let it shine, let it shine, let it shine. Excellent.
Language is normally held in the left hemisphere of the brain, where Gabby was injured. Music exists in both hemispheres. Incredibly, scientists are finding that music therapy can rebuild language on the uninjured right side.
Nothing activates the brain so extensively as music. It had been possible to create a new language area in the right hemisphere, and that blew my mind.
Today, Gabby's getting back to a normal life, venturing out to restaurants, even ordering in French.
Walking is easier all the time. You're stronger.
Strong.
Very inspirational. Okay, well, I'm going to bring the band back. Epilepsy is a condition of a tendency toward having recurrent, unprovoked seizures. Seizures are sudden bursts of uncontrolled electrical surges in the brain. Believe it or not, up to 1 in 26 people in the U.S. will develop epilepsy over the course of their lifetime. Side effects of anti-seizure medications are common, and in up to a third of individuals, medications alone will not work. So additional therapies that can help in part actually would be very welcome. Very glad, thank you. Anybody recognize the composer? That is actually Mozart, and it's known as the Mozart K448 Sonata for 2 pianos, but he only has 2 hands. He can't play 2 pianos at once, but it certainly sounded close enough. Well, in 1993, there were studies performed by Professor Rauscher that suggested that simply listening to 10 minutes of complex music like the K448 could bring about enhancement in spatial temporal reasoning. And boy, this spawned a major cottage industry. Suddenly, remember hearing about all the Mozart this, Mozart that, Mozart baby, this and that, with this idea that if we only just spend the time listening to 10 minutes or so of this music, we can all become geniuses. Unfortunately, the effect was not really well produced in later studies. Some suggested that this Mozart effect simply was that music was, in certain types, was provoking more alertness, more arousal but it was not really building longer-term higher intelligence or other cognitive skills. However, this did inspire the epilepsy community to look at the Mozart K448. And then you started to see some case series in which exposure to the Mozart K448 seemed to be reducing the frequency of abnormal discharges in the brain, those in between seizures we call interictal sharply shaped waves or spikes, and actually even to lower the seizure frequency. I was very honored myself to be given the opportunity to help mentor an MD PhD student working at Dr. Barbara Jobst and Professor Michael Casey's Dartmouth University program. And what we showed is when you had electrodes that were implanted into deep areas of the brain in individuals who happened to be undergoing epilepsy surgery evaluations, we exposed the patients to a short segment of the K448, and we looked at the frequency of these discharges, and then we compared it to other classical musical pieces or noise or other things, and we actually saw a striking difference with a reduction in frequency. I don't think this therapy is ready for prime time, but it's very intriguing, and it does suggest that certain musical stimuli actually might even be helpful for not only the anxiety and stress that comes with epilepsy, but maybe epilepsy itself. Let's talk about another subject very related to music, which is dance. So the complicated coordination of dancing activates many centers in the brain. The cerebellum, sensory structures, deep structures called the basal ganglia, memory, and thinking areas. I want to tell you that my wife and I have taken dancing lessons for decades. You wouldn't know it looking at me dancing. But I must tell you, it is an amazing workout. And one challenge you would never get from other mental exercises like crossword puzzles is when you're on the dance floor and you're doing especially ballroom dancing, you have to make split-second, rapid-fire decisions about where you're going next. What's the next move? Oh yeah, I remember that step. Should I use that step? And that kind of novel processing has been speculated to be associated with developing cognitive reserve, which may be helpful in the context of reducing problems with dementia. It may promote development of new neural connections. So to get you in the mood, and we want audience participation, even though you're a little